Hi guys, hope you're all doing well. Today is our Sunday instalment. For this one we are actually taking a viewer request because it links to the more serious side of our Sunday videos. Jennifer asks, can you please do a video describing how hard it is for the caregiver? Who do you think the cancer journey is harder for, the patient or the caregiver, or any chronic illness? Who is it harder on? Well, that's a very broad question to ask, and it's a very good question as well. I don't think you could really say that it's more difficult or easier for any particular party in certainly our case, because we know that it was very difficult for Charlotte going through the cancer, but she also was very much aware that it was very difficult for us to care for her. So not only is it physically draining for the actual person with the illness, but it's also very emotionally draining. And on the flip side of that, it was exactly the same for us, because it was very physically draining having to look after Charlotte, but it was also very emotionally draining having to see her get iller and iller, and our duties as caregivers get more strenuous.
And I think also with caring for somebody, it was going back to where she was on 50 tablets a day, trying to coordinate all that, remembering when you had to order stuff, endless lists. At the worst, she was on morphine patches, morphine tablets. In the latter part where she became very ill this year, she was on 35 tablets a day, and they all had to be very, very carefully coordinated. Some were with food, some were without food, and trying to cram into a whole day was virtually, it was very, very hard to do, and it was even harder to try and watch Charlotte swallow these pills. So I think Caring Goes, it covers such a wide variety of giving, and I agree with Mars, it was terrible for Charlotte, but it was very, very hard for us to see somebody deteriorate very quickly. I don't want to actually talk too much about that deterioration, because when we explain her cancer journey, I think we want to sort of pull that together right at the end. But the caring goes from driving up to the Marsden every day for 7 weeks for radiotherapy. Coming back, she would be absolutely wiped out. So it was care all day, every day, when she was very, very poorly. And this was going back 2 years ago. And I think you witnessed more of it, I think, in the second bout of the illness as to the first part, because you were still at university then. I think carers are, I'm not saying us, we're not unsung heroes, but I think there are an awful lot of people in this country who do so much caring, and it does go totally unnoticed. Whether you're caring for young or for old. I mean, I found it more difficult, I have to be honest, caring for Charlotte than I did for my mum, because I felt, well, you've had your life, you've had a really good life. She was 95 when she died, Charlotte was 19, so it was difficult, and at one point we were actually looking after both of them who were both ill.
You talk about the emotional strains with mine and Charlotte's grandmother. Actually, Charlotte was, by the end of it, by halfway through her glioblastoma diagnosis, far less able than Grandma, who was 95. Yes. I mean, by the end of it, she was absolutely unable to function in any way whatsoever. At all.
And I think we were just, from our point of view, it was unfortunate having to watch two people go downhill very, very quickly.
Well, there is a particular reason I picked up Cat here, and apart from her being very cute and fluffy and sometimes quite scratchy, because she, I think we were all unanimously in agreement that she actually offered a lot of care to Charlotte as well, because she would sit with her every day when Charlotte was bedbound, and I don't think for a minute that was because there was someone in the bed, it was because Charlotte was in the bed. And after Charlotte passed, Nala and I spent quite a lot of time on our own together when I was waiting to get my job off and running, and when you're in the hospital overnight, I stayed here, and she was very, very confused and lonely, and she still, to this day, Charlotte bought the very nice chair from Habitat, and she always says, I never want that mingy cat on my chair, and now Nala always sits on the chair. So I think, even to that extent, I think even animals notice when there's something awry. Charlotte would obviously be up so early, be doing her makeup, and then suddenly over the last 2 months she wouldn't get up, basically.
I think also going back to the caring, after Charlotte had radiotherapy, she would spend a lot of time in bed because she was so tired with it. And it's 24-hour care. It's not just 2 minutes, it's 24 hours. When she was ill after that, it was, I need a heat pack, I need this, I need that. It was the toilet, and It's draining. I do feel for all these people who are caring, you know, for relatives or whatever. As I said, being purely selfish, I just found it very, very hard to actually have to, you know, care for my 18, 19-year-old daughter. I find that quite difficult compared to, I suppose, to elderly people. It's a club that I wish we hadn't had to be in, but we are in it, unfortunately. And we're just learning to cope, even now, just learning to cope with everything. It was, you know, you have to be very careful with the chemotherapy, and in fact when we first came back from the Marsden, it just blew my mind. That was back in the July-August 2013. We had this enormous file, which actually I reduced down to about one sheet of paper after 6 months because I'd sort of got so used to everything. But we came back with things to put needles in, and you can't do this, you have to store this all over the place, it has to be kept at a certain temperature. It was all absolutely mind-blowing, and that's, you know, you have to be so careful with the medication, how you give it, and it's caring for somebody 110%, and it is very draining, and I admire anybody who is going through the caring process, which is most people actually, I think, nowadays, because there is very little help available to care for people.
I think the other point is, if any of you guys know people who are especially younger who have told you about incidences or ongoing processes of having to do full-time care for maybe their parents, you have to tell someone, because there are charities that can alleviate that, not necessarily a burden, but can make that challenge a lot less hindering to people's everyday lives, especially teenagers, because you shouldn't have to, although you kind of feel like you do. There are people that can help you.
So anyway, yes, it was very hard. There is, as I said, there is more we could talk about, but we are trying to do Charlotte's journey, and I don't really want to start at the end of her journey and work that way. So we will be talking certainly in depth about the last month at a later date, which was, all I can say is, truly awful, absolutely awful. Anyway, Wednesday's video, because we've actually got half term, hooray, this week. So we're not sure which video. Somebody did come up with quite a nice one of doing, was it a blog?
Yes.
Yes, so we probably will have a look at that and maybe get a friend of ours involved if we can. And next Sunday, we're not quite sure, but we've got an awful lot of requests, which is great. And we will obviously try and incorporate Charlotte's journey as well. Thank you for those who are following on Facebook. As I said last week, I don't Facebook, you know, it's just, I don't want it just full of pretty pictures, because I'm trying to get a message out there about how evil this brain tumour is, and I'm trying desperately hard to raise awareness of it, very much so. And obviously there will be photos, but primarily it will be facts and information as well. So obviously please follow us on Charlotte's Legacy on Facebook and also on Twitter.
Thank you for watching, guys, and we'll see you on Wednesday. Hopefully today's video has given you a bit of food for thought, as we haven't given you enough already. There's a bit more, so hopefully something to think about. And as I say, there are a lot of charities out there, so if you do know someone who's suffering or is really struggling under the burden of having to care for people, even if it's yourself, do try and contact those people and give them a look on the internet, because there are charities available to help with that. So we will see you on Wednesday, guys. Take care. Bye bye.
Bye.